G'day, it's Dan from PT Direct here, and today I'm going to be talking about low back pain, in particular what you can do to protect your clients from suffering from it. Now, in the 18th century, famous American Benjamin Franklin stated that nothing in life is certain other than death and taxes, which is sadly completely true. In the 21st century, we could probably add low back pain to that statement, as it seems that just about all of us will suffer low back pain at some stage in our lives. So whether it's you or your client, you need to know how to deal with it. As personal trainers, when we're delivering our exercise sessions to our clients, it's really important that we protect them from injury occurring. But also, by providing the right training experiences, that we help to prevent injury occurring in our clients outside of those sessions as well. Now, when we get our clients into the gym, we're often adding compressive force or compressive load onto their spines. And the more compressive load we put onto the spine, the greater the chance of injury occurring. Now, compressive load or compressive force is simply any force that pushes down. So gravity is a compressive force that is pushing down on us all the time. And the weight of our upper body is also a force that compresses into the lower back. And that's why the lower back is more prone to injury than structures higher up, simply being there is more compressive load on the lower back than there is higher up. Then when we add weights such as barbells with weights on the end, we're simply adding more and more compression. And that's not a reason not to add load, because your clients still need to achieve results. But it is a reason to make sure that we're activating structures that will protect the lower back especially while we add that load. And there's two schools of thought on the best way to do that. Either that we hollow our abdominals or we brace our abdominals. Now, you may well have heard cues such as suck your belly in or draw your belly in towards your spine. That's a cue for the abdominal hollow, and it's been really well embraced by the fitness industry, largely because some very advanced trainers have proposed that that is a way to activate the deep transverse abdominal muscle, and that muscle is most important for lower back protection. Sort of ignores the fact that we have a lot of muscle around this region, and all of that muscle has a function for protection. So on the other hand, the brace, which is simply a conscious stiffening or squeezing of all these muscles to activate them all, is a better way to provide stability. Simply, the more muscle I have activated, the greater the chance of protecting my spine. Now, I've got a simple demonstration to show the merit of these two ideas. Got 2 cans of soft drink here, which naturally I haven't drunk because soft drink's really bad for you, and we'll cover nutrition in another section at PT Direct. My full can, much like my abdominal brace here, the structure of the can, much like the structure of my midsection, is supported by all the contents within it being active. By squeezing the muscles, I'm also putting a bit of pressure into my midsection, just like there is also pressure in the can. So when I apply compressive force, I can apply a lot and it resists it really well. On the other hand, my abdominal hollow, much like my empty can, by hollowing the abdominals, I've actually turned off most of the muscles in that region, so they're not active, just like emptying the contents out of the can. I've now put a big kink in the can, much like I've done when I suck my belly in. And when I apply compressive force, it doesn't take much to crush that can. Sadly, like it doesn't take much to actually buckle my lower back or buckle my spine. Now I'm going to come back to the abdominal hollow versus the abdominal brace, but first of all we're going to do a quick recap of some of the anatomy of the spine and the midsection.
The spine is made up of 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the mid-back, and 5 lumbar vertebrae in the lower back. Now, the spine has inward curves known as lordosis curves in the lumbar and cervical regions, and an outward curve known as a kyphosis curve in the thoracic region. When the curves are normal, as shown here, the spine is said to be in neutral, and a neutral spine is very strong as force is evenly transferred through all the vertebrae. However, many of the forward-leaning positions adopted in work result in these normal curves disappearing or being accentuated. Commonly, the lumbar curve flattens, and this is a major cause of low back pain. The spine is designed to allow forward and side bending, namely flexion, extension, and a small degree of rotation. However, any excessive movement puts undue stress on each intervertebral joint. In the lumbar region, excessive and prolonged flexion stretches the ligaments that hold the vertebrae firmly together. This can lead to ligament tears and avulsion fractures, where segments of bone are literally torn away by ligaments. When the spine extends, those stretched ligaments will struggle to keep the joints secure, further exposing the spine to injury. Intervertebral discs, which function as shock absorbers, consist of a soft gel-like nucleus surrounded by tough fibrous outer layers. When they are exposed to excessive movement, numerous pain-inducing injuries can occur. As a result of uneven forces being applied, the normally flat discs can produce bulges, or in extreme cases herniations, where the gel-like nucleus of the discs breaks through the tough outer layers. And if this herniation pushes against the spinal cord nerves which run through the vertebrae, back pain will likely be extreme with any type of movement. Now, over time, and especially if care hasn't been taken to protect the spine, discs can degenerate and thin. With less space between vertebrae, there is an increased likelihood of spinal nerves being compressed, also resulting in severe back pain. So when training clients, firstly keep a mental picture of what a neutral spine looks like, in particular the moderate inward curve in the lumbar region. And make sure that whenever an exercise is being performed, that the lumbar curve is maintained, as in these pictures. And with that same mental picture in mind, make sure you identify cases such as this deadlifter where his lumbar curve has completely flattened, and intervene to improve technique whenever you see this. Because in examples like this, it's not a case of will an injury occur, it's purely a case of when will it occur. There are a number of muscles that all work together to protect the lower back from injury. On the anterior, these include the transverse abdominis, the deepest abdominal muscle that wraps around the spine, the internal oblique muscle on the front and side of the abdomen, the external oblique also on the front and side of the abdomen, and this muscle sits on top of the internal oblique. Now the fibers of the internal and external obliques run in opposite direction to each other, and this helps contribute to stability in the midsection. And lastly, the most superficial abdominal muscle, the rectus abdominis. Note that this muscle appears to be in 4 sections. Now this actually helps to limit the amount of forward flexion that the muscle can produce. The muscles on the front of the abdomen work in conjunction with muscles on the back to protect the spine. Some of these key muscles include the quadratus lumborum, or QL, which attaches the hip to the lowest rib and hooks onto all the vertebrae in between. Also the erector spinae group of muscles, which runs up the entire length of the vertebral column, and the deep multifidus muscle, which also runs up the spine, but its individual fibers are not as long as the erector spinae group and span only a few vertebral segments each. Now these muscles all have specific individual functions for movement. For example, quadratus lumborum helps to sideways flex the spine so we can bend from side to side. However, these muscles all also have a common function that includes protecting and stabilizing the lumbar spine by contracting together to lock it into neutral.
Okay, so key things to remember. When you're exercising your clients, make sure that they always maintain a neutral spine, because the neutral spine is the safest, strongest position for the spine to be in, especially under load. And what we really want to do is we want to lock the spine into neutral, especially that lumbar spine. And how we do that is by activating all the abdominal and lower back muscles. Do that by bracing the abdominals and not by hollowing. Now what I want you to do is actually feel the difference between a brace and a hollow. So I want you to stand on up if you're sitting down. Put your hand on the side of your hips as such. Dig your thumb and your fingers into your midsection. Now consciously squeeze all your abdominal muscles. You should feel quite a bit of tension pushing against your fingers and your thumbs. With against your fingers, you'll be feeling your oblique muscles and of course the transverse abdominis underneath those. Where your thumb is, you should be pretty close to your quadratus lumborum, and just on the side of your spine, you'll feel the erector spinae muscle and of course the multifidus muscles underneath those. So again, consciously brace or squeeze all those muscles, and you should feel tension instantly develop in the erector spinae muscles as well. The interesting thing being is that that abdominal brace activates all of those lower back muscles as well as those abdominal muscles. In comparison, let's have a feel at what goes on with the abdominal hollow. So, same position, dig your thumbs and your fingers into your midsection. Now no squeezing of the abdominals. Just consciously try and draw your stomach in. You should feel quite a difference. The fact is, there really is very little going on in terms of muscle activation with that abdominal hollow. So it should be pretty obvious to you now, protecting the lower back from injury, especially while you're lifting, involves activating all of those muscles, not just one. Okay, last thing. To really make sure that your clients are protected from back injury, you need to have an input as to what's going on outside of the gym. Bear in mind, you might train your clients twice a week. That's really only going to give you about 2 hours of input. The client's still got 166 hours in that week where they can injure themselves. At the moment, you can follow the directions on your page and get access to our guide for clients to alleviate low back pain and protect the lower back from injury. You can get that guide, work through it with your clients because it's got heaps of information on how to sit, stand and lift safely at work and play. There's some simple exercises to alleviate low back pain, and there's 3 really simple exercises that you can teach your clients to do to work or build endurance and strength in these midsection muscles. Okay, that's all from me today, folks. Thanks a lot for listening.